of you might have seen from my community post the other week that we found a lump on Charlie a few weeks ago, and it turned out to be a fatty cyst, which we are super grateful for. But I thought it would be helpful maybe to do a short video on what to do if you find a lump on your dog, what to do if it's cancerous, and some treatment options. So that's what we're going to go over in today's video. And I have Thor here with me on the floor, so if he makes an appearance, yeah, that's who it is. But first, I'd love to know, have you ever found a lump on your dog before? If you have, leave a paw emoji in the comments. And also, if you're willing, I'd love you to share a little bit of your story there as well, so we can help others and let each other know that we're not alone in this journey. And if your dog has never had a lump before, go ahead and leave an X emoji in the comments and let me know how old your dog is so we can celebrate a life that is currently lump-free. Finally, the best way to support me, my dogs, and this channel is to hit that like and subscribe button. The more likes the video gets, the more widely YouTube will distribute it across the platform. From the boys and I, from the bottom of our heart, love and thank you to each and every one of you. So sit back, relax, and let's get into it. So as I said, this subject is near and dear to my heart because just a few weeks ago, we found a lump on our older dog, Charlie. He had just turned 7 in January, and as you know, Bernese Mountain Dogs, typical lifespan is between 7 to 9 years, sometimes 6 to 8 is the average. So they don't live very long. That's one of the major downsides of the breed. So we know that, we have a senior dog in terms of the breed and what that means. And we were also equally worried or doubly worried because we had lost our last Bernese, Odin, to cancer at 7.5 years old. So he was diagnosed with lung cancer, and then within a month he was gone. So it was very quick. The other concern is that the lump on Charlie was or is in the same spot as Odin's lump was. So it is up along the chest wall. However, the difference is Odin's was a little harder and it was like stuck to the chest wall. And I don't know how else to explain that. Like you just couldn't pull it off of the body. So Charlie's lump is squishy. You can pull it completely off of the body, like it's not attached to the rib cage, if that makes sense. I would say right now it's about 1 inch in diameter. So it's still fairly small, but it's always scary finding these things, especially if you have lost a dog to cancer before like we have. So here are some do's. So the first thing you should do is contact your veterinarian. Now, it is important to note that a vet cannot diagnose anything just by looking or feeling the lump. I don't care how good they say they are, even the best specialists in the world cannot definitively tell you what it is without looking at it under a microscope or sending it off to pathology. The only way to diagnose it and make sure that it is something benign or not is to stick a needle in it, get some cells out, and put those cells under a microscope. And this is called a fine needle aspirate, and it's something that's done right at your veterinarian's office. The dog doesn't need to go under anesthesia. They can do it, right there, either in the room or take the dog back. It's quick and painless. And you don't need or you shouldn't need to have a special appointment for it. The vet can do it right at the appointment that you made to have the lump seen. Every vet is going to do it a little differently, but our vet looked at the cells taken under a microscope because there's a bunch of things that she can see and diagnose right there in the clinic from that alone. And this would include lipomas, which are the most common benign fatty tumors that are found in dogs, or mast cell tumors, which are the malignant or cancerous ones. There are some other ones, but those are the two most common as to whether or not it is something benign or something cancerous. But if for some reason your vet isn't able to come back with a diagnosis from the aspirate or is just unsure about it after looking under the microscope, step number 2 would be to ask your vet to send those cells off to a pathologist and use their expertise to get a diagnosis. If your vet doesn't feel comfortable or can't diagnose it locally, this is the only true way to get a definitive answer and the best way to know what your next steps should be. So again, the fine needle aspirate is what we did in Charlie's case, and luckily the vet called about 2 days later and said that it is a fatty cyst, so it is a lipoma, it is benign. Obviously we will keep an eye on it to make sure, if it has any changes, if it gets any bigger in size, and because of where it is on his chest wall, it's not causing him any mobility issues or any kind of, daily life activities. He can go on as normal, so there's no need to take it off in his case right now. But what do you do if the fine needle aspirate does come back inconclusive or does come back as, say, a mast cell tumor or something that is cancerous? So your vet could say that they want to surgically remove the lump entirely and then send it to pathology for a biopsy. But the problem with this, if there is a suspicion that your dog does have a mast cell tumor, the treatment for that is wide surgical incision. So for example, let's just say that this lump was on your dog's leg. There's not a ton of tissue there, so it's almost impossible for your vet to get good margins via surgery. And it's also maybe going to interfere with your dog's ability to be mobile, to walk. So in these cases, depending on where the tumor is, surgery to remove it entirely and send it off to pathology can sometimes turn into what's called a salvage procedure. So this would mean, possible amputation or palliative care. And if you're talking about oncology surgery or cancer surgery, the first surgery that is done on your dog is the best chance for a cure. So you really don't want to have a vet go in a second time because the chances for a good outcome are much lower. So my best recommendation based on our own experience and our own vet recommendations is, if you're willing and able to afford it, have your vet do a fine needle aspirate first instead of removing the lump via surgery right away. Then if it comes back on the needle aspirate that it could possibly be cancerous or it's inconclusive, then ask your vet to send the aspirate or the cells off to a pathologist to have a true, thorough biopsy done and get the diagnosis confirmed. If it's confirmed that it is a mast cell tumor, the pathologist should be able to grade it, which means they will be able to tell you either, how aggressive or severe it is. And this will also help drive your treatment choices. A couple of other types of masses that can look like mast cell tumors include histiocytomas and a few other things that aren't nearly as scary as a mast cell tumor, so it's always better to err on the side of caution and get it tested to know for sure. And even so, best case scenario, you send the aspirate to a pathologist and it comes back benign. So then if you did end up having to do surgery because the lump was of such size or in a location that it was interfering with your dog's daily life and activities, it would be a much smaller surgery because you wouldn't need to do, or your vet would not need to do as big of margins, would not need to take as much tissue. And if it is a mast cell tumor, you can talk about all the other options such as amputation, palliative care, injections, chemotherapy, or anything else that your vet recommends. So moral of the surgery, take the path of least resistance first. Do get a fine needle aspirate. Do see if your vet can diagnose the type of cells from that right there in the office. And then if they can't, or if they do have suspicion that it could be, or they conclude that it is cancerous, you can then send it off to a pathologist to get a more definitive diagnosis of what type of cells it is, and then, talk about treatment options. So I hope this was helpful. I wanted to kind of keep it short, just give you the steps to take and some recommendations based on our experience of having gone through both cancerous cells in a dog, and then in Charlie's case, at least for right now, it is benign, and we are very grateful for that. So again, like and subscribe this video if you got any value from it. And I do have channel memberships available now, which I'm super excited for. So that includes things like badges, I reply first to your comments, live Q&As, additional videos that are for subscriber members only. So if you would like to support the channel and the boys in that way, you can just click the membership button down below. So again, I hope this was helpful. Hope you're having a great weekend. Don't forget, berners are best, and I will see you in the next video.